Hello and welcome. My name is Obatin Otu. As a medical professional, I've dedicated my life to understanding the human body, its incredible resilience, and its vulnerabilities. Today, we're embarking on an important journey together, one that touches millions of lives around the globe. We're going to be breaking down the 10 most common types of cancer and how they impact the human body. This isn't just about statistics or clinical definitions. It's about understanding what's happening inside us, demystifying the fear, and empowering ourselves with knowledge. It's a topic that can be difficult, I know, but it's one we must face with clarity and courage. The word cancer itself can evoke a powerful, often fearful response. But knowledge is one of our greatest tools against fear and against the disease itself. By peeling back the layers and looking at each type individually, from its origins to its effects, we can better comprehend the challenges patients and their families face. We can learn to recognize the subtle signs our bodies might be sending us and understand the critical importance of listening to them. Throughout this discussion, we'll keep coming back to a fundamental truth that I've seen proven time and time again in my practice. That truth is simple yet profound. Early detection and awareness can save lives. It's not just a catchphrase, it's a medical reality backed by decades of research and countless stories of survival. By being informed, we become active participants in our own health. We can make better lifestyle choices, know when to seek medical advice, and support our loved ones on their health journeys. So let's begin this crucial conversation not with fear, but with a commitment to understanding and a hope for a healthier future for all of us. First, let's talk about breast cancer, one of the most widely discussed and researched cancers. It originates in the cells of the breast, typically in the ducts that carry milk to the nipple or the lobules that produce the milk. What happens is that these cells begin to grow uncontrollably, forming a tumor. While it's most common in women, it's important to remember that men can get breast cancer too. The most well-known sign is a new lump or mass in the breast, but it's not the only one. Other changes can include swelling, skin dimpling that looks like an orange peel, breast or nipple pain, and nipple retraction or discharge. Understanding these signs is the first step in early detection. If left unchecked, these cancerous cells have the ability to break away from the original tumor. They can travel through the bloodstream or the lymphatic system, which is like a highway network throughout our bodies. This process, known as metastasis, allows the cancer to spread to distant parts of the body, most commonly the lymph nodes, bones, liver, and lungs. Once it spreads, treatment becomes far more complex, and the impact on the body's overall function is much more severe. This is why regular self-exams and mammograms are so critical. They can catch the cancer when it's still confined to the breast, making treatment more effective and survival rates significantly higher. Now, let's turn our attention to the lungs, the vital organs responsible for every breath we take. Lung cancer begins when cells in the lung tissue start to mutate and multiply uncontrollably. Often this is linked to smoking or exposure to secondhand smoke, but it can also occur in people who have never smoked due to factors like radon gas, asbestos exposure, and genetic predisposition. In its early stages, lung cancer can be a silent intruder, often producing no noticeable symptoms. As the tumor grows, however, it can cause a persistent cough that doesn't go away, coughing up blood, chest pain that worsens with deep breathing, and shortness of breath. These symptoms are the body's alarm bells, signaling that something is wrong within the respiratory system. The danger of lung cancer escalates significantly as it progresses. The growing tumor can block major airways, leading to lung collapse or recurrent infections like pneumonia. If it metastasizes, it can spread to the other lung, the brain, bones, liver, and adrenal glands. This widespread disease can lead to a cascade of complications, from severe pain and neurological issues to jaundice and ultimately multi-organ failure. The prognosis for advanced lung cancer is often poor, which underscores the immense importance of smoking cessation and avoiding environmental carcinogens. For high-risk individuals, screenings like low-dose CT scans can be a lifesaver, detecting the cancer at an earlier, more treatable stage. Prostate cancer is a significant health issue, particularly for men as they age. This cancer develops in the prostate, a small walnut-shaped gland located just below the bladder that is responsible for producing seminal fluid. In many cases, prostate cancer grows very slowly and may not cause serious harm. However, some types are more aggressive and can spread quickly. In the early stages, there are often no symptoms at all. As the tumor enlarges, it can press on the urethra, leading to a host of urinary problems, a frequent need to urinate, especially at night, a weak or interrupted urine stream, and difficulty starting or stopping urination. These symptoms can also be caused by non-cancerous conditions, so a medical evaluation is essential. If the cancer becomes more advanced, it can cause more severe symptoms like blood in the urine or semen and discomfort in the pelvic area. The most serious concern is when the cancer metastasizes beyond the prostate gland. Prostate cancer has a tendency to spread to the bones, which can cause significant pain in the hips, spine, or ribs, and can even lead to fractures. It can also spread to lymph nodes and other organs. Regular screenings, which may include a PSA blood test and a digital rectal exam, are crucial for men, especially those over 50 or with a family history. Early detection allows for a wider range of treatment options, from active surveillance to surgery or radiation, dramatically improving the outlook. Next, we'll explore colorectal cancer, which starts in the large intestine, either the colon or the rectum. This type of cancer often begins as a small, non-cancerous clump of cells called a polyp. Over time, some of these polyps can develop into cancer. This slow progression is actually a window of opportunity for prevention and early detection. The symptoms can be subtle and are often dismissed as common digestive issues. They include a persistent change in bowel habits, such as diarrhea or constipation, rectal bleeding or blood in the stool, persistent abdominal discomfort like cramps or pain, and a feeling that your bowel doesn't empty completely. These signs should never be ignored. As colorectal cancer grows, it can penetrate deeper into the wall of the colon or rectum. From there, it can invade nearby lymph nodes and blood vessels, providing a pathway to other parts of the body. The liver is the most common site for colorectal cancer metastasis because the blood from the colon circulates directly to it. The lungs are another frequent site. When the cancer spreads to these vital organs, it can severely impair their function, leading to jaundice if the liver is affected, or respiratory problems if the lungs are involved. This is why screenings like colonoscopies are so incredibly important. They allow doctors to find and remove polyps before they ever have the chance to become cancerous, effectively preventing the disease. Unlike the cancers we've discussed so far, which form solid tumors, leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. It begins when the bone marrow produces abnormal white blood cells. These cancerous cells don't function properly and they multiply uncontrollably, eventually crowding out the healthy blood cells, the red blood cells that carry oxygen, the platelets that help blood clot, and the normal white blood cells that fight infection. This cellular takeover is what leads to the primary symptoms of the disease. A person with leukemia often feels profoundly tired and weak due to anemia, which is a shortage of red blood cells. The lack of healthy white blood cells severely weakens the immune system, making the person highly susceptible to frequent or severe infections. Furthermore, a low platelet count means the body can't stop bleeding effectively, leading to easy bruising, tiny red spots on the skin called petechiae, or prolonged bleeding from minor cuts. The spleen and liver might also become enlarged as they get clogged with the abnormal cells. Leukemia is a systemic disease from the start, meaning it's already circulating throughout the body. Treatment, therefore, must also be systemic, often involving chemotherapy, radiation, or stem cell transplantation to wipe out the cancerous marrow and replace it with healthy, functioning cells. The liver is a powerhouse organ, performing hundreds of essential tasks, from filtering toxins out of the blood to producing bile for digestion. Liver cancer, or hepatocellular carcinoma, begins when the cells of the liver, called hepatocytes, develop mutations in their DNA and start to grow out of control. The biggest risk factors for liver cancer are chronic infections with the hepatitis B or C viruses and cirrhosis, which is severe scarring of the liver often caused by long-term alcohol abuse or other chronic liver diseases. In its early stages, liver cancer may not cause any symptoms, but as the tumor grows, it begins to disrupt the liver's vital functions. Symptoms often include unintentional weight loss, loss of appetite, pain in the upper abdomen, and nausea. One of the most telling signs is jaundice, a yellowing of the skin and the whites of the eyes, which occurs when the diseased liver can no longer effectively process bilirubin, a yellow pigment. Another common sign is abdominal swelling or ascites caused by fluid buildup as the liver fails to produce enough of the protein albumin, which helps regulate fluid in the body. In its most severe stages, liver cancer leads to complete liver failure, a life-threatening condition. Protecting the liver through vaccination against hepatitis B, avoiding excessive alcohol, and managing underlying liver conditions are key preventive strategies. Skin cancer is actually the most common of all cancers, but the type we worry about most is melanoma. It's less common than other skin cancers, but it's far more dangerous because of its ability to spread rapidly. Melanoma develops in the melanocytes, which are the cells that produce melanin, the pigment that gives skin its color. Exposure to ultraviolet radiation from the sun or tanning beds is the primary cause, since it damages the DNA in these skin cells. The first sign of melanoma is often a change in an existing mole or the appearance of a new, unusual-looking spot on the skin. We use the ABCDE rule to spot potential melanomas: asymmetry, irregular border, uneven color, a diameter larger than a pencil eraser, and evolving or changing over time. If caught early, when the melanoma is still thin and confined to the outermost layer of skin, it's almost always curable with simple surgical removal. The danger really arises when the melanoma grows deeper into the skin. Once it reaches the blood vessels and lymph channels below the surface, it can metastasize to almost any organ in the body, including the lymph nodes, lungs, liver, and brain. Advanced melanoma is notoriously difficult to treat and, unfortunately, can be fatal. This is exactly why regular skin checks, both by yourself and by a dermatologist, are so important. And of course, the best defense is prevention: using sunscreen, wearing protective clothing, and avoiding peak sun exposure. Pancreatic cancer is, honestly, one of the most aggressive and deadly cancers out there, and that's largely because it's just so difficult to detect in its early stages. It begins in the tissues of the pancreas, which is an organ that sits deep in the abdomen behind the stomach. The pancreas really has two main jobs. It produces enzymes to help with digestion, and it also makes hormones like insulin that regulate our blood sugar. Cancer can develop in either the enzyme-producing or exocrine cells or in the hormone-producing or endocrine cells. Because the pancreas is tucked away so deep in the body, tumors can actually grow for quite a while without causing any symptoms at all. And when symptoms do show up, they're often pretty vague and can easily be mistaken for other conditions. These symptoms might include pain in the upper abdomen that radiates to the back, a loss of appetite, and sometimes significant unexplained weight loss. If the tumor blocks the bile duct, it can lead to jaundice, which is that yellowing of the skin and eyes. New-onset diabetes can also be a warning sign, since the cancer disrupts the pancreas's ability to make insulin. Pancreatic cancer has a high tendency for rapid progression and early spread, often reaching the liver, the lining of the abdomen, and even the lungs. By the time it's diagnosed, it's frequently too advanced for surgery, which, right now, is the only potential cure. This really grim reality highlights just how urgently we need better early detection methods for this silent killer. Cervical cancer starts in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. What makes this cancer unique among many others is that we actually know its primary cause in almost all cases, and that's persistent infection with high-risk strains of the human papillomavirus, or HPV. HPV is an extremely common sexually transmitted infection, but in most people, the immune system just clears it on its own. In a small percentage of women, though, the infection sticks around and can cause cervical cells to gradually turn into cancer cells over many years. This slow transformation gives us a really critical, long-term opportunity for detection and prevention. In its early stages, cervical cancer usually doesn't cause any symptoms. As it gets worse, it can lead to abnormal vaginal bleeding, like between periods, after sex, or after menopause, as well as watery, bloody vaginal discharge with a foul odor and pelvic pain or pain during sex. If it's left untreated, the cancer can spread to the bladder, rectum, and then to distant organs like the lungs and liver. But honestly, the truly remarkable story of cervical cancer is one of public health success. With the PAP test, which can detect precancerous cell changes, and the HPV vaccine, which prevents the infections that cause them, cervical cancer is now largely preventable and highly treatable when it's caught early. Brain cancer refers to the abnormal growth of cells within the brain. These tumors can be primary, meaning they start in the brain tissue itself, or metastatic, which means they've spread to the brain from cancer somewhere else in the body. Primary tumors are classified based on the type of cell they come from. Gliomas, which start in glial cells, and meningiomas, which form in the meninges, the layers covering the brain, are two of the most common types. Because the brain is enclosed in the rigid skull, any growing tumor, whether it's benign or malignant, can cause serious problems by increasing pressure inside the head and interfering with normal brain function. The symptoms of a brain tumor really depend on its size, type, and location. Common signs include new or increasingly severe headaches, unexplained nausea or vomiting, and vision problems. A tumor can also cause seizures, which are often one of the first indicators. Depending on which part of the brain is affected, a person might experience gradual memory loss, changes in personality or behavior, balance problems, or weakness in one part of the body. Treatment is incredibly complex, involving a delicate balance between removing the tumor and preserving critical brain functions. The impact on a person's life can be profound, affecting everything from their ability to walk and talk to their very sense of self. We've covered a lot of ground today, journeying through 10 different types of cancer, each with its own origin, its own signs, and its own unique impact on the human body. What I really hope you take away from all of this is a clearer picture of these complex diseases. While cancers differ by location, from the breast to the brain, many of them share common themes and symptoms, like profound fatigue, persistent pain, and the eventual dysfunction of our most vital organs. We've seen that what begins in one small area can end up having consequences for the entire body. But cutting through all of that complexity, there's a single unifying message of hope. And that message is that early detection and treatment are absolutely key to improving survival and preserving quality of life. For so many of these cancers, finding them at an early stage, before they've had a chance to spread, really transforms the prognosis from dire to hopeful. It changes the conversation from managing a widespread disease to curing a localized one. This power, the power to change outcomes, is something we can all access. It doesn't just reside in complex medical technology, but in simple, proactive steps that we can all take charge of in our own lives. So, I want to encourage you to be an advocate for your own health and for the health of those you love. Stay informed about the risks and symptoms we've discussed. Please, don't dismiss persistent changes in your body as nothing. Get your regular checkups and recommended screenings. They're truly one of the most powerful tools we have. And most importantly, consult your doctor if you notice any unusual symptoms. Your awareness and your willingness to act on it can make all the difference. Thank you for joining me on this important journey of understanding.